Hey, you guys, and welcome back to another episode of Change the Conversations. I am really excited to have a relatively new contact and relationship on the show today. His name is Victor Elmurr, and we actually have a couple of loops that overlap that we've been discovering. So he's treating my husband, and also now the new myofunctional therapist that's sharing office space with me, Jenny Quintana, works at a dental partner's office where he does chiropractic work. So we knew each other through Jenny and then also through Nick Belden, who's a functional chiro, and he and I have been on each other's podcasts. So a couple of fun loops. We got to work on each other last week, and I'm just really excited to have him on. His approach to chiropractic is definitely not just the more typically thought of rack 'em, crack 'em. And so I'm really excited to have him share about how he's changing the conversation and treating clients. And we've had so many fun conversations already that I'm excited to see where today goes. So Victor, please just tell everybody a little bit about yourself.
Yeah, thanks for having me on. Just when we chat casually, it's always fun to see how it goes. So I'm excited to see what happens here. And it's always nice just having it recorded. So I got started in chiropractic really when I would say it all began was breaking my back in my sophomore year of high school. So I played football, a lot of heavy lifting involved as well, and just repetitive spinal extension or arching of the back. And that took me kind of down this like rehab slash training realm that I was kind of self-discovering. And then I did a mentorship at a small gym in Columbus, Ohio, where I eventually got hired. He told me to go to a massage therapist and probably like 30 minutes north of us. And I always make the joke that when I got off the table, I forget the name of it right now, but those body pains of someone kind of like on the pavement where they're one
Chuck
arm.
drawing. Yeah.
Yeah. I left like that shape of a sweat print on his massage table because he dug his heels so far into my piriformis and my QLs that I was like total sympathetic. But I was like 70% better after one session when I was told you're going to need surgery, you're going to need to quit football. And this guy gets me better in one set, like 70% better in one visit. I was hooked. And the sensation of it. It felt like he would hold the pressure and then just this almost like ball of tension or energy or whatever you want to call it. And then he would just like move it and it would like literally leave that region of my body. And then I would get up and my low back would pop and I felt so much better. So that was mind blowing. Eventually, I would go back to him and just be like, yeah, this kind of hurts. I would just like make stuff up. So I just wanted to keep feeling his work on me and keep learning. And eventually, so I went to massage school because of him. And then towards the end of my massage school career, I started taking seminars. I think the first one was DNS, which stands for Dynamic Neuromuscular Stabilization. And that was in Columbus, Ohio, with a chiropractor named Richard Elmurr. He's the one who got me into chiropractic. So it was at one of the seminars that I was like, I want to be that guy. And everything that he said was making sense as far as just how much the breath influences how we stabilize and how we move. And I'm very much like a root cause kind of person, which I think a lot of people are. And so when I heard like how much breathing affects our movement, I was like, that just makes sense to me. Like the brain's going to prioritize getting oxygen to itself. He's talking about all these muscle firing patterns with the hip flexors and the low back and all this that the brain will use to keep trying to breathe. So that'll throw your squat off or your hip range of motion or whatever. And so then I began my undergrad journey at Columbus State Community College, did 2 years of prerequisites there. And then I shipped myself off to Logan University just outside of St. Louis for 3 years. Met a bunch of lifelong friends who are great people, some in Tennessee, North Carolina, some stayed in St. Louis. And then, like you mentioned, Nick, he is not too far from either of us right now in Arizona. and he's crushing it with his wife. And yeah, and then so with all the breathing stuff, so Dr. Olm kind of introduced me to that side of chiropractic. That's how I got introduced to chiropractic. So when I went to school, that was my idea of it, was rehab, breathing, posture, stability. And so I ended up being a representative for the R2P club, Rehab to Performance Club, for a couple of trimesters, 3 or 4 trimesters in school, and just kept taking seminars, learning all that stuff on the side, because we definitely don't get that in the curriculum. And then when I graduated, I somehow got in contact with a dentist back home in Columbus who just ranted for 45 minutes about upper airway. And I was like, I'm so obsessed with breathing at this point. I was like, oh my gosh. So I probably read like 8 books over the course of like 2 months just on the upper airway stuff, and seeing all these crazy stories of tongue tie releases and expansion and shoulder range of motion and chronic neck pain and toe walking and all kinds of stuff. And I was just like, dude, this is super awesome. So I was already planning to move to Arizona, got here, made a list of holistic dentists, and just kept cold calling. And I think Dr. Mon, who is at Natural Dental Partners, the owner, he was probably like the second person I called, and he called me back and was stoked about it. And then he was just begging me. No, I'm just kidding. He wasn't begging me, but it was honestly like our mindsets are the same on health and just life, and we just meshed. So I've been there the last 2 to 3, coming on 3 months now, and helping them with their airway program. So they don't diagnose and technically don't officially treat sleep apnea or snoring, but what they do will definitely help. And then so I'm there to support the posture from the bottom up, as we say. So keeping the airway open and optimizing what myofunctional therapists are doing with tongue posture, by way of getting someone's breathing proper, the rib cage in a good position, so their spine and mostly their neck and upper back, thoracic spine are in good positions, so that their tongue, their jaw, all the other stuff that we need to stay nasal breathing all the time is in a good position to do that. I'm also treating typical chiropractic patients. So anything from headaches, neck pain, shoulder pain, carpal tunnel, plantar fasciitis, low back pain, whatever. So yeah, that's my long summary. I went a lot longer than I thought I would, but that's
And
how
that's
I
all
got
we have
to
time for,
where
guys. No, I'm just kidding.
Yeah.
No, I mean, I think that's important though, just because I want to loop back to something you said about, you think most people want to get to the root cause. I think if you asked most practitioners in any field of health, they genuinely care about getting people better. I don't think, obviously these are all just our opinions, but I don't think that everyone pursues a broader understanding of what root cause might mean. Because as a business owner, and like you're basically in business for yourself, I have my own business, which is different, I think, sometimes than having a job where you work for another employer. But either way, I think that sometimes if I help a client get to their true root cause, that should and might mean referring them out. Right.
Mm-hmm.
So like from a business standpoint, it doesn't always behoove us, but it would be pure ego if we were to say like, I can help everyone get to their whole root cause of everything they have going on. Mm-hmm. So I just wanted to kind of loop back to that and pause there a minute and maybe go a little deeper, because while yes, I agree that everyone is trying to do right by clients, I don't know that necessarily everybody dives into root cause or dives into what that could entail for someone. Like in our chit chat before we actually started, I just air quoted for everybody who's just listening, but talking about all the different ways into the subconscious and all the different ways into some of that deeper mind, body, emotional, biopsychosocial, all the factors, right? Levels of healing.
Yeah, I feel like I was just going to bring up the word healing. That's what we were talking about before we started recording, just how I use the word weird, but fascinating, beautiful, random that healing can be and sometimes is. Like, you read some people's like spiritual awakening stories, like Eckhart Tolle, for instance. I think in The Power of Now, he kind of describes it towards the beginning. He's just really, really depressed. And then, I don't know, I had this really trippy experience as he was going to sleep one night in his 20s, and then woke up the next day and was just like, totally something shifted. And that's what he does for a living now. He teaches spirituality. Um, Other
Or even what we were
people.
talking about, the power of our beliefs. And it's like,
Mhm.
I don't remember who originally said it, but whether you think you can or think you can't, you're right. And
Yeah.
that's putting it very, very simply, but just how the placebo effect of any one thing, or I think last week we were talking about, I had that client who his pain dropped just after hanging up his phone from making an appointment with me, because he just had relief in his mind of knowing he was finally going to get some help. And just those different things about how our beliefs factor in to our journey and what we're capable of. And I just love meeting other people that are open to however that might come about. And that was probably one of the first things that I enjoyed speaking with you about, was just like, we can just go down these rabbit holes of how do we get someone there, and how do you get them there, and how do I get them there? And, how would we get them there if you worked here? And like, just some of these, they can even just be hypothetical conversations. But so my next question to you is, I don't think I've talked to a lot of different chiropractors, and there's a lot of different schools of thought and philosophy and even schools of chiropractic care out there, but I don't think it's all that common to find chiropractors trained in or focusing on airway.
Yeah, I would say so.
So tell us more about that piece and why you feel like that's so critical for clients.
Yeah, and before I do, I wanted to kind of connect what we're talking about with the healing
Oh,
aspect,
sure.
and what you said about like how a lot of practitioners, they want to do right by patients and clients, but I think the biggest problem, well, one of the big problems is like this intellect driven, logic, factual based, objective, evidence based, like it only can be this way. And they're almost like looking at matter, like the physical form of reality, and not zooming out more to, like you just said, like that client got relief just talking to you on the phone. Like, that's part of this guy's journey, and now that's information for you. Maybe what you do with your hands, I mean, I told everyone after you worked on me, I was like, she is so gifted. I don't know how or why we would refer, but we need to refer to to Amy. um but point being, like, what you do with your hands may be a little bit less relevant, and just how you're coexisting with him in your session energetically might be his therapy. Obviously, all of it is together, and we can never really just separate one thing. But I think that's a big handicap in today's medicine, is people not zooming out enough. And obviously, we see with specialization, like we have a kidney doctor, we have a bladder doctor, we have an adrenal doctor, we have what thyroid doctor, like,
Cardiologist, yeah,
yeah,
pulmonologist,
one
yeah.
body part, and then they just, and I don't blame people for getting stuck. You can study one organ your entire life and not know everything there is to know about it. That's mind boggling. But the problem becomes, like, you become so zoomed in that you forget to zoom out and see not only the rest of the body, but also
The
someone's
whole
entire
being.
life and being.
Yes,
Yeah,
their whole being.
exactly.
Again, you guys that are listening could not see me, but when he started, I was raising the roof and throwing a party over here, because, again, not to discount the need for research and validation, but the phrase evidence-based makes me want to vomit, because they're trying to throw out everything, and you cannot nail down people's lives.
Yeah.
Every single human experience is different. And that's why this podcast is called Change the Conversations, because we can't just keep hammering the same nail. It isn't working. And everyone's experience of every type of treatment will be different, and will be through their lens, and will be with all of their life's experiences to that point. And that is not possible to research. And we are so already centuries behind in researching anything related to women that I don't feel like the best use of our energy is trying to catch up. I feel like the best use of our energy is to move forward, and to, not that everything can just be anecdotal evidence. I get that also, but humans aren't meant to be standardized.
Yeah. And actually, a colleague, I forget who it was, used the phrase evidence informed. And I really liked that. It's like it's there, but being
Yes.
evidence based is like a little bit more strict, I think. And evidence informed is like you're saying, it's there, it's informing our practice. Maybe it gives us a little bit of a container, of course, of like what's safe, what's not safe.
Framework. Yeah.
Yeah, but I think, yeah, if you're too evidence based, you miss the art of what we do. And even as a medical professional with an official license and doctor in front of our names, like it's healing and it's an art, and it's non-linear. We know that. That's in the evidence. And
There are no
sometimes
straight lines in nature.
yeah,
That's proven.
exactly.
Yeah.
So
That's an
yeah.
evidence-based statement. There are no straight lines in nature.
um yeah, and I think there's other things too, like just how rigid our minds become, and separating us from nature is a good example too. It's like if we zoom out and think of us kind of as animals or whatever, like we look at how animals in the wild, the things that they need, okay, we need just about the same things, and most of us don't get those. Let's start there: sunlight, good sleep, grounding, movement, community, all these sorts of things. And probably a bulk of most people's stuff would at least decrease, if not go away. So I don't know. Yeah, it's a mess out there for sure. It's crazy, but I think there's a lot more of this, kind of like how you and I think and practice. I think that's kind of shining through a little bit. Um, but your other question was about chiropractic and airway. So my experience was I got very, and still am very, obsessed with how the breath influences the entire body. So nervous system, lymphatic system, circulation, mostly the musculoskeletal system. Actually, on that note, I remember I started lifting in middle school with my dad, lifting weights with my father, and just got like totally mesmerized by like bodybuilders. I was like, you can see the striations, you can see the fibers. Like, felt kind of weird at the time. I was like, why is this so cool to me? And it still is. Um, but how the breath can affect that system, the musculoskeletal system, has always been a huge interest of mine. And then PRI, Postural Restoration Institute, and then DNS, which I mentioned earlier, both look at the body. So there's still the neuromuscular aspect, the brain and nervous system controlling the muscles and the joints and movement. But instead of only looking at levers and pulleys, we are a pressure based system. So you take a breath in, the diaphragm goes down, the lungs fill with air, the rib cage changes shape. Everything has to change shape to accommodate the breath.
The pelvic
And
floor
then,
goes down. Just throw that in there. Yeah.
yes, the pelvic floor descends.
Scratches the diaphragm.
There you go. And so yeah, we're a pressure based system, and you can look at muscle contraction the same way. You can look at measuring shoulder range of motion the same way. Vision, how we, like everything, how we move is pressure based. So they add another dimension to studying movement that really ties the breath in, because breathing is the only way to change the pressure from the inside out. So how that ties into airways, I would say it's decently obvious. Of course, if I kind of use this analogy of like the top of the straw, like if there's a kink at the top, your palate's not big enough, your actual upper airway around your throat area is too narrow, then it doesn't really matter how much your diaphragm and everything below that I like to look at is functioning. But I also think vice versa. You can do all the expansion that you want on the roof of the mouth, open the top of the straw as much as you want. But if you're not optimizing rib cage position, pelvic floor position, and having that whole canister work together with that upper airway, your results are going to be limited, in my opinion. Um, so yeah, just like it was just perfect for me. It's one of those like big things for me that just fell in my lap, honestly, because I love the breathing thing. And then that dentist was like, "Oh yeah, upper airway." So I was like, "Oh my gosh, I have to jump on this." And then I found out through experience. I went to the AACP conference 2 years ago in Spokane, and Dr. Mueller, who was on another mutual connection, flew me up. Well, didn't fly me up there, but let me go. And everyone was obsessed that a chiropractor was there. Like even the dentist who have been doing this for 30 years was like, "Who's a chiropractor? Who's a?" I was like, "Dude, these people are drooling over PTs and chiros, and nobody knows about it." And like from a business standpoint, like you were talking about, like if you want a good referral source, like these people are looking for practitioners to work on their patients to optimize their results. And it's
Right.
not unethical. It's just you're working on the soft tissue and the joints and making sure they can move well so they can sleep better. And I mean, as we both know, if you're getting good sleep, blood sugar, brain
Immune
health,
system. Yeah.
everything, literally everything. So yeah, it was kind of honestly just kind of poetic and like just fell in my lap, one of those things. And so far I'm really enjoying it. I can obviously I treat the pain side of things, but it is really cool when there's no pain in the situation and you can just look at pure function and look at their posture and how they move, and then seeing that change within a session or over the course of multiple. And something that DNS talks quite a bit about is the quality of movement, which is maybe less evidence based and objective, but you can kind of observe someone. Like we've all seen it. Like you watch someone move and they move gracefully and fluidly and smoothly, and there's just something that looks aesthetically pleasing to it by nature. And then you get the people who move like a pile of bricks. They don't swing their arms and they're kind of waddling like a penguin, or their feet are turned out, or the head is forward, and you see their rib cage is just like it's like stale air is inside there, and you just want to get them to exhale a couple times. Maybe that's just me, but um, you can see it in their movement, and
We would have
I
a good
think
time
that
at the airport.
yeah,
Or the
yeah,
mall. Oh my gosh,
it's a
geeking out
great
on
place for
everybody's
people to watch.
anatomy. Yeah.
Yeah. I was actually listening to a podcast last night. This guy was saying that Vladimir Yonda, who was the upper cross, lower cross syndrome guy who kind of created that thought process, one of his best pieces of advice was to get really good at training your eyes. I've heard multiple stories from multiple practitioners that he could identify someone's injury by looking from his peripheral vision. He would just watch them walk like a couple of steps, and he'd be like, their ankle or their knee or their shoulder or their neck or what, from his peripheral vision, could tell what was going on with their body. And that's what I think needs to almost be revived. I know some chiropractors I look up to are trying to kind of continue that and pass that torch. But that is so like being at the airport, like I I don't know, I'm fascinated by it. So like I use those are free reps, like why not?
Yeah.
So when someone comes in, I'm better at my job, and I can tell a lot better now when someone's in pain, or if I shake their hand I can kind of tell how their spine's going to feel or the range of motion. I work at the joint part-time, gotten a lot of reps, so like how someone talks, their eye contact, how they address me, their handshake, like all these soft little subjective things, the quality of their being, so to speak. And then I match that with what I'm feeling with my hands. Um, So yeah, I don't know. I think it's so fun. Yeah, I don't know. I'm just obsessed with it. So
Well, it's interesting you bring that up because when I think back, the first skill John had us work on, John Barnes, with myofascial release, and the very first course I took with him was soft. We stepped back from a client who was ideally either a male shirtless with shorts on or a female in like a sports bra and shorts. Step back and soften our focus and just
yeah.
look for, and even brawl, we learned to feel for the lines of tension through the top of the head and to
Hmm.
soften that focus and look for those patterns and look for the lines of tension, the torque, the rotation. And like you were saying, when you see somebody who moves with ease and then any dis-ease in the body, disease, it's just literally where is ease being blocked? Like when you
Hmm.
really boil it down, like, so yeah, I
Yeah,
love
it's
love
literally
that.
it's tension. Like that's I don't know how.
Blockages. Yeah.
Yeah, I don't know. Maybe it was a dream. I don't know. Sometimes I don't remember when the thought came to my mind. But yeah, I forget what the context was now. I feel like I was either listening to or reading about like even like visceral disease, like internal stuff, and I'm like, it's tension. Like, I mean, high blood pressure is tension on the capillaries, the blood vessels, the heart. Like, so yeah, I definitely think it gets reflected in the musculoskeletal system too, but not a lot of people want to take the time to get good at it, nor do they maybe think that it works that way. But
Yeah.
yeah, I'm kind of jumping around a little bit. I did really like your point about softening your focus. I've kind of intuitively been doing that as I kind of do my postural, like standing evaluations, because you can't, if you like try to focus too hard, you miss the whole picture. So yeah, softening your focus is a really good phrase there. So just like almost like you're relaxing your own internal environment and just seeing everything that they're like their entire body globally, how it's organized head to toe. And then you can start to pick out what might be tight or pissed off or whatever. Um, and I really like doing that and having both lenses, really the PRI and the DNS lens, to take in that visual information into and kind of filter it. So someone's rib cage, I think you used the word shear last time we met, about you were talking about your pelvis shearing. Like if their rib cage is sheared to the right or sheared to the left or whatever it is, or their head on their neck, same thing. What that means through a PRI lens, because I expect someone to look a certain way based on the patterns that PRI has kind of given us and the asymmetries. And so if they look outside that pattern, then I kind of have like a red flag of like, okay, like there's extra torsion and tension in the system. If they walk in, their right shoulder is lower, their right hip is a little bit higher, their rib cage is sheared over to the right a little bit, then I'm like, okay, like no big deal. They're in the base pattern, their head is tilted to the left. But if any one of those is any sort of opposite, or their shoulders are even, but they walk like they just have that tension in their rib cage, I'm like, oh, all right, your shoulders might look even, which is fine, but underneath the hood, when we actually measure range of motion and palpate your muscles, there's just more tension in the system than you would think. So someone can look symmetrical without being symmetrical. So
The
um
body is extraordinary about compensating and compensating and shifting until it can't. And I like to
yeah.
try and help people understand too. I know you do too. Like, you don't understand how many, and it varies for everybody, I think, but you don't understand how many of those shifts and compensations have occurred by the time you get symptoms. So
Mm-hmm.
trying to recognize that and help people understand, like, if you listen to those cues sooner, you'll need a lot fewer treatments. I was even talking, my ops manager and I meet every Monday, and I was telling her I had this podcast with you today, and she remembered you coming in, and I was talking about you, and I was talking about Jenny Quintana, and I said, from a business perspective, if I collaborate with those kinds of providers, it might on the surface not seem like the smartest business move, because if Jenny and I treat a patient, and we're both doing our jobs right, they're going to need fewer sessions with me and probably fewer sessions with her than either of us alone. But here's the beautiful part. They're going to get way better results. And that's ultimately what makes my heart happy in the first place anyway. And yes, we all need to pay our bills, but that's also going to make them thrilled to the moon, and they're going to tell people, and it's going to make the person who referred them to whichever one of us it referred them to. And like, same with you. Like if you and I actually were treating a patient, both of us, they would probably need fewer sessions with both of us, but it's still going to be a win all the way around because they're going to get more lasting relief, more thorough results, and they'll be happier. And, you know, yeah, so I was like, just explaining that to her when we were looking at different things that might be coming up or shifts we might be making in the new year, and just some of those plans. And it's really easy to get, we were talking about this beforehand, to get bogged down in the marketing and the messaging and the staffing and the scheduling and the budget and the blah, 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 blah.
Yeah.
Charlie Brown, right? Like the weeds, I call them the weeds. But I would much rather talk about the collaborating and the partnerships that are going to accelerate, like sharing clients with Mallory, who's a naturopath here. People's hormones are balanced and they're sleeping better. Like that's netted better results. Like that's the fun part to me, is like, how do we do this better? And like I love that you brought up art of healing. And I feel like that was what learning, and again, a lot of people can get there a lot of different ways, but for me, that was what learning the John Barnes myofascial release work gave back to me, was my love of the art of healing. And that's where the magic is. And that's where people take over their own healing and anything can happen. And so, yeah, I freaking love all of that stuff.
Yeah, I remember you mentioning how much studying under Barnes like shifted your approach and your mindset. And yeah, I would say I naturally had that, and then school like took it away from me. And then I was almost like judging myself for naturally being that way, and it was just totally getting in my way. And honestly, I would say now looking back, without even trying, it's like being in this self-development program that I've mentioned to you a couple of times has like naturally allowed me to shed that. It's like I need to show up as my most like authentic self, and because people aren't going to want to come in or get treated by me if I'm pretending to be someone else that I'm not anyway, which is super cliche, but like it's a very repelling thing. I'm not going to get good results. I don't even believe in what I'm doing. Like, how are they going to believe in it?
Yeah.
And yeah, from a business standpoint too, what you were mentioning, like getting people better sooner and then them being happier and referring more people. The other thing too that's really prevalent and relevant in the chiropractic space is the idea of maintenance care. And another thing that this program has gifted me is the ability to find a creative solution. And so one of the things that I didn't like about working at the joint, as well as other chiropractic clinics, was the use of fear to get people to get on maintenance care. If you don't come in once a week for the rest of your life, then you will have pain. This like if then statement, and the patient's scared into coming in. Okay, cool, you're making money, but now they're stressing out and they don't believe in their bodies. And the intelligence, innate intelligence, is another thing that gets absolutely made fun of in the space, which I think is horrendous. So I was able to step back and be like, okay, maintenance care makes sense for the patient. Maintenance care makes sense from a business standpoint. There's got to be a creative solution here. I was like, well, can't they just come in because it feels good and it benefits them? Let's just do it. Let's just say it that way and let the results speak for themselves. And I think there's enough value there. People want to get massages once a month. Why is getting an hour-long session with a chiro or PT such a sin?
Right. I tell people too, like, I want you to, so sometimes for our clients, we'll call it like a year of care thing. It's so that it can make it more budget friendly, so that it's easier for them to take care of themselves, but also it's almost like a little bit of a safety net. And can we just honestly acknowledge that for our minds, they might not physically need it, but for their minds, for them to know they're going to see me next month, they can go play, they can go live, they can go do the things they want to do. And they're not that fear of making themselves worse again, or that fear of injuring themselves, or that fear of messing it up or needing surgery, or whatever that thing is that's hanging over their head. This gives them that little bit of safety net that they can just go live and not think about it and not worry about it. Cause they're like, in their minds, they're like, well, I'm going to see her next month and she'll check everything and it'll be fine. And but then they're having a better quality of life in the meantime for the 6 weeks or 2 months that they're not seeing me. Yeah, there's a million ways to make it a true win-win. And I love that that's kind of where your thinking's at, because it's 100% possible and ideal.
Yeah. And I could totally see like, so the other, like the counter argument to what you said, which most people, at least that I've seen, use is, well, you're creating dependence on you from the patient to take care of themselves, etc. Fine. Do you fix your own car, your own plumbing? So it's like, no, you hire people who went to school to learn those things. Is it such a bad thing that we went to school to learn how the body works and take care of people to do the same thing? Now, I think, I think you would agree that there should be a learning curve / giving of the responsibility to the patient or client, where we're kind of a check-in space. And if something pops up symptom wise, or they're like, hey, like my shoulders just, I don't know, I want to optimize this for whatever reason, then we can do that for them. But in the meantime, they're being active and take care of themselves and being more self-sufficient, but we're kind of just guiding them through like a longer term development. Again, I hate to keep harping on this program, but like that's one of the things that this teacher that I have, has really harped on. Like a lot of us think of patients as like seconds, minutes, hours. This guy's logging on like days, weeks, months, and years. And I'm not saying we have to have a patient for 10 years for them to feel better or anything crazy like that. But the point being, like, we can let this spread out more and guide someone. It took us 3 years to pass boards and take tests and learn how the body works. And me and my classmates are 2 years out of school, and we've all learned a ton being in practice. And it's like, so we have 5 years of some level of chiropractic experience. Why would we expect a patient to be totally self-sufficient in a month or whatever?
3 months even.
But I think having a smart process to make that happen.
Well, I think another key difference, I totally agree with everything you said, but another key difference, like when you're sort of using that devil's advocate argument, not only do we get maintenance on our cars and go to experts for all the different things, but also I'm not telling them they need it. I'm not telling them, like you said, the fear-based tactics. I'm not telling them something bad's going to happen. I'm giving them a choice. And having that choice or having that appointment on the calendar makes them much more confident to live their life and do what they want to do in the meantime. So yeah, I mean, I think if I was saying, well, if you don't come back, you might just prolapse and have to have surgery. Like if I was saying that, then obviously that's a fear-based tactic and many people use it. But yeah, like you're talking about giving them a choice of what feels good. And yeah, massages are part of our year of care and I have a client who comes in every 3 to 4 weeks. She's done that 4 years, and it's because it keeps her migraines at bay. It's because she knows she has a busy schedule. She herself is a physician, and some of her call shifts are demanding, and she knows she's not always the greatest about her workouts and her home program. And so if with her intentions of doing those things that I've empowered her to do and her own knowledge empowers her to do, in combination with getting treated regularly, keeps her living the lifestyle she wants at the pace she wants, I'm not telling her she has to come in to stay symptom free. She's recognized that's what's working for her. So I think too, like you're empowering them to make a choice also, again, as long as you're not using those fear-based tactics. I think something else that's super unique about you, that is for sure not the route of a majority of practitioners and chiropractors, is the fact that you ended up doing massage school first.
Yeah, I did. Um, it was, and honestly, so like looking back on it, from starting lifting weights with my dad in middle school is when I started reading and watching YouTube videos. I remember like Pete Bomarito in Florida and Exos down here in Phoenix. Like these are the people that I was like learning from on YouTube, at least as a middle schooler, and just kept going through. And then by the time massage school hit, I had a pretty good grasp on exercise and like hip hinging, just like the basic stuff. And then in chiropractic school, it was really cool to have my first person experience of massaging someone totally change as I was learning intellectual information. So like when I would massage someone, it was like I was almost blind to anything other than muscles and joints. And then as I would learn about internal organ systems and disorders, I'm like almost visualizing like this hollow body with organs, because that's what we are,
Yeah.
organs and such inside. And like I would feel more things with my hands and like skin temperature and like hair, and I don't know, just different, just more and more things I would appreciate. And so it was really cool to almost get better with my hands by just learning book information. And I would say the opposite is also true. But yeah, it was a huge blessing to start with massage. It was one of the things that I would experiment with some of the breath work as well, when I would have people's necks who just feel like bricks. I'm like, how are you doing anything with your neck right now? And we would do a couple of breaths down into the belly. I would try to almost tell them like breathe into your pelvic floor, because you want the breath getting down that low. And all this, like within like 3 breaths, I could feel it in my hand. Their scalenes or neck muscles would just like melt. And I always use the analogy of like a stick of butter in a pan. Like it literally would get warm and like smooth and almost like squishy like. And I was like, dude, I don't have to break my thumb. I don't have to make you cry, and your neck is actually going to get looser from the breath work. And so I could experiment with just some mobilizations and stuff that I actually still use as a chiropractor. I'll dig my elbow into a QL and use some different releases, or use some pelvic mobilizations, or a lot of neck stuff, I would say. But yeah, no, it was really cool to have that experience. And I just love working with my hands too. Like I thought about the reality of, okay, like if I wasn't a chiropractor, what would I do? And it's like, I don't know, man. I love touching bodies. I love and feeling the change, and doing the manual therapy. This is really, really cool. Yeah, massage school was a trip, and that whole journey was definitely very helpful. And there was a lot of people in school who were not nearly as comfortable putting their hands on people, like especially at the beginning when we were learning adjusting. Granted, adjusting is a whole other beast, but just to put your like human contact, I didn't realize was such a barrier for a lot of people. And so I just like would go in there and just start like palpating and touching, and like some people you could see them being kind of skittish and timid about their contacts on spines or whatever. And so that was another kind of silver lining of massage school, and that massage aspect of things. And yeah, maybe it's influenced my perspective, kind of keeping things from like the neuromuscular aspect, and just looking at soft tissue and joint position. But
Oh,
yeah,
I'm
I
sure it had
really,
to. Yeah, I'm sure it
yeah,
had to shape your
yeah,
awareness and perspective of all that.
I
Yeah,
definitely
that's
am like
amazing.
a muscle, I would say a muscle, well, really neurology, but nervous system first, but like muscles dictate whether the joint is going to move, how much, what direction, if it's being held. Obviously, there's other things too, but from a just purely physical standpoint, that's how I view it. And I think a lot of people are actually doing it the opposite these days, where like, which is true, like bone position is going to dictate muscle function and tension and stuff, but you can't move a bone, in my opinion, without some sort of muscle contraction. Like the muscles move the bones and the joints influence the muscles, but I don't know. That's a whole other
I was
thing.
gonna say that would be quite the rabbit hole, because we could go down, and I would challenge that connective tissue trumps muscle, and then does the nervous system trump the connective tissue?
Yeah, I mean, it really is a big loop, huh? Because
Yeah,
like your
vagus
input
nerve
is
is,
also an output, which is also
yeah,
an input.
it is a
And the
big loop.
connective tissue
Yeah,
is so innervated.
right, right. So it's like, all right, so is vagus nerve king? And I think that's
Yeah.
why we love studying, right? Is because, and so much of it works. So much of it works. And there's so much power in human touch and connection. And you know, we're sitting here on Zoom today, but I'm sure we would both rather be working on each other than
Yeah.
just having a conversation on Zoom.
You had me like literally melt in the floor. Just, I don't know what. And I remember I was pretty bloated when I laid down, and just my intestines. And I know you worked on my stomach a little bit. And by the time you were done, I just felt like just a puddle of Victor just laying,
A
was
puddle of
totally
Victor. That's awesome. Yeah, I think it's
melted
probably
on the
good you
floor.
worked on me first. You're pretty
Yeah.
sleepy after. Yeah, not the best day for an office potluck for sure, but we'll do it again soon.
Three bowls of chili
Oh my
and
gosh.
chocolate cake.
Cake. I was like, you ate what? Um, well, one question I like to start wrapping things up with is, okay, and I'm going to make you narrow it down to one. So you just
Okay.
have to pick one out of all of the things that people, the average person thinks about chiropractic, and you amongst your own colleagues. What is the one thing you are most passionate about changing the conversation around?
One? I'm just kidding.
One.
Um, yeah, I would say how much I mean, yeah, I would just say that how much the breath influences your muscle tension and how you're moving. Period.
That was my guess, just based on talking to you and how passionate you are about
How'd
that.
you know?
Well, and I mean, I agree. I mean, that was a huge, the power of breathing is a huge part of why I opened the yoga studio in the first place. Like truly, the ability for people to learn how breath can bring healing to their bodies and their minds. And that's why we've added a breath work to the schedule every week. We used to have breath work like workshops. So now we have a breath work class every week and sound healing every week. And just, there's not a lot in this world that helps us slow down and breathe well and reset. And so I really agree about the power of breath and how that kicks off like the core of the canister, right?
Yeah, and it's
Our pressure
really
system.
a good segue. I mean, I know we're wrapping up, but just like if you're breathing well and you're in a relaxed state, usually, wink wink, nothing else is really going wrong in the body if you can stay out of that chronic flight or fight or stress mode. And the breath is a really good way to communicate that to the nervous system. And yeah, a lot of people, I mean, belly breathing, like forward, like belly button forward is a good first step. But then getting that lateral or side to side, east to west expansion, and then also ultimately getting your back to expand without having to round your spine, that's, you're kicking butt
Magic.
if you can do that. So I mean, your shoulder, everything's going to be in a lot better position. Your muscle tension will be better. Your organs are, in my opinion, literally getting massaged by your diaphragm and your pelvic floor at that point. Your abs are working better. I mean, everything that people want is just not what convention has us thinking.
I talk all the time about like it's not necessarily easy, but it's not as complicated as we think. And it is the most simple superpower that we all have access to.
Hmm.
Really like, because yeah, when you go into massaging the organs and how they each all have their own motility, and you get the liver functioning better, which is directly connected to the diaphragm. And guys, I did not even pay him to add in that piece about the pelvic floor. He just did it.
Yeah.
Because he knows stuff. Yeah. So I agree. And anything else that you want to wrap up with as we're just sort of talking about healing here?
Um, yeah, I guess as far as like the traditional chiropractic route, um, I know obviously like you've mentioned, like I'm quite different from the typical traditional. So like traditional being walk in, you just get adjusted and you walk out. You might go home with a stretcher and exercise. That typically looks like banded external rotations at the shoulder or glute bridges or clamshells and
Or the
these
cervical
things.
device?
Yeah, these things aren't bad. I actually have like a little cervical pillow over here. I've been trying out a little traction thing.
Mm-hmm.
Um, where was I going? Oh, but really, I think, I mean, spending more time getting to know your body, like someone might need glute bridges, but your body might not. Um, so having someone that takes the time with you to figure out your body and where you're building a relationship, and kind of like we talked about, eventually maybe getting on that maintenance care where you can dive deeper into how your body moves and responds to things, I think is really the way forward with chiropractic care.
Yeah, that's
Um,
amazing. Well, and you guys just know, anybody listening, like it is possible to undo your holding patterns. It is absolutely possible to heal your body and heal trauma and stop those bracing patterns that are part of what I feel is why you do end up needing to go back. We default
mhm.
into these bracing patterns that are in the subconscious. We don't know we're doing it. We don't mean to stand that way. We don't know we're gripping in whatever area we're gripping. And so, yeah, I love your approach, and it is very different. He often spends anywhere from 30 to 60 minutes with a client, you guys, which is definitely not the chiropractic norm by a long shot. Speaking of which, where can people connect with you, find out more about what you have going on, find out where you're treating, at least as of right now?
Yeah, so my Instagram is just Victor VICTOR underscore Elmurr, ELMURR. And then so that has a little link to my chiropractic website, which is connectedchiroaz.com. And then so you can kind of schedule, find more information through that website. Then also Natural Dental Partners is the dental office I'm with. They're scheduling and billing and all that stuff for me. So ultimately, if you want to schedule, contact them. But if you want more information, my Instagram or my website's a good place to go.
And we'll link that stuff in the show notes to you guys. So thank you so much for taking the time to have this conversation and to be changing the conversation. I think it's really critical, just with the face of healthcare these days, and people are using the internet to seek their own options out a lot more independently. And so just trying to provide options and information and help people know what's out there. So appreciate your efforts in that regard and look forward to talking more soon.
Yeah, thanks for having me. This was fun.
All right, you guys, tag us, share it out, like it, subscribe, do all the things. You guys know what to do, and we'll talk to you on the next episode.